I'm Mary with REM Community Connections, and today we have Heather joining us.
Hey, hi.
Hi, Heather.
Thank you for having me.
We're so excited for you to be here.
Me too. I'm excited to be here.
Extra excited.
Okay, so Heather, I know a little bit about how you started your career in healthcare, but everyone would like to know what got you into healthcare and what were your first experiences with the senior community. Yeah, so actually, my first job was working in an office at age 14. I worked at the EDD office every summer in the youth program.
Wow,
and I learned a lot doing that. And then when I was 18, I got hired for the Bureau of Indian Affairs, and I worked doing office clerical work. I thought that was going to be my life, just being in the office, and ended up switching and working for the Yolo County Office of Education, and just being in the office every day, being repetitive. I didn't really have passion for it. I ended up being fired, and when I was being fired, the lady told me, maybe it's just not for you. Some people, I wouldn't try to go be a nurse. And that stuck with me, and I was like, because I was taking care of my grandpa too at the time, part-time, and I was like, I think I could do this as a job, as a career, because I loved being with him. He's an older man in his 90s. He had Alzheimer's dementia, so I would go and cook for him in the morning, do his laundry, clean his house. We would visit all day long, and it's funny because when he was younger, he was kind of like a grumpy man, and then when he got older, when he got the Alzheimer's, he was like the sweetest man ever, and he would call everybody baby and honey, and he was just so sweet, and it was just so nice to see that part of him. So I ended up changing career paths and became a caregiver at Palm Gardens, assisted living in Woodland, and they also had a memory care unit, so I worked in both. I worked in just the regular, what do you call it?
Assisted
living part, and then I switched into the locked unit. It was a locked memory care unit, and I really liked it back there. And I just have a heart for our residents with dementia and Alzheimer's.
I have to say that you definitely do. Like, the way you interact with the residents is very what's the word I was going to use?
Inspiring.
Inspiring, yeah.
Thank you.
So you already went over your first job in senior care, and that was Palm Gardens. And then how did you, I know you became a CNA later on. So when did you decide to get your certification to be a CNA?
Yeah, so when I was working at Palm Gardens, there was other girls there that were getting their CNA license and moving on to their career path in nursing. So CNA, then LVN, RN, that was like the path that other people were taking, and I thought, I want to see what the next step would be for me too. And I think I would like to do nursing, so I got the CNA license, ended up working, or did clinicals in Sacramento it was called Emerald Gardens, but now it's called Capitol. Mm-hmm. So that was back in like 2010 is when I got my CNA license, and I really liked it. It was like fast.
Hands-on.
Yeah, I was really hands-on. I enjoyed the residents there. I got to know like a lot of their stories, and it was a different population. It wasn't just elderly. It was like younger people too.
Yeah,
like we had a resident.
Mm-hmm.
Yeah, we had a resident there that was fairly young, and her daughter was there with her. So
it's hard work.
It was emotional. You get attached to people. So I did my clinicals there, and then I ended up getting a job my first job was at Alderson's in Woodland, because I live in Woodland. So I really liked it there. It was like a mom and pop kind of place, and they really cared for all their staff there, and you got to know like all the DON and the owners and everything, and I enjoyed working there. And then I ended up moving over to Woodland Skilled Nursing, and then that's where I met Yachty. Yeah.
2011.
Yep.
Both grinding as CNAs.
Yep.
It's hard work. Skilled nursing and CNA work is hard work with big patient loads.
Oh yeah.
And it builds character, for sure.
It definitely
It does.
It definitely shows you like a work ethic. Like you have to be on it, and we're not flipping burgers, we're not folding clothes,
You're dealing with people.
we're caring for people. Like
It teaches you patience, that's for sure.
definitely.
Yeah.
So, how did you get to Courtyard? What attracted you to Courtyard? And how was your journey to Courtyard?
So I actually was working at Davis Healthcare, Sierra Healthcare, when it had the electrical fire that it had, and we had to evacuate everybody.
I remember that. I was working at Cottonwood.
Yeah.
We had a
And-
lot of your guys.
Yeah, a lot of our residents went kind of to the local facilities, and some of our residents,
Yeah.
some of our residents ended up going to Courtyard. And so I ended up going to be with our residents and some of our staff that went there. Yadi actually was working there at the time as social services director, so I went to be with Yadi also. She's so fun to work with.
She is.
We follow
she
each
is.
other.
Yeah. And she, it was actually not doing CNA position. It was actually they had an admissions position open on the weekend, and it was part time. So I went there on Saturdays and Sundays, and then I actually really liked it because I also enjoy patient care, but then learning like the insurances and building census and that part was kind of exciting. So I enjoyed it. And then when they had an opening for Monday through Friday, I ended up applying and ended up doing that.
So how long have you been at Courtyard altogether now?
So I went there right after I had my son, 2016. So 10 years.
Oh my gosh.
Yeah.
Wow,
She's a
that's
Courtyard.
good.
Yeah.
Lifer, I'm a lifer.
That's for sure.
It's time to get a little
Yeah.
CY tattoo, girl.
I know. Working in admissions, you get both. Like, you get to experience both worlds.
Mm-hmm.
The administrative side, and then you get to do, like, the hands-on and spend time with the patients. And
Mm-hmm.
when you're going over, like, paperwork and...
Yeah, I like the problem solving part of it too.
Mhm.
Yeah.
So as an admissions director, like what does a day in your life look like?
Oh, it's busy. Like the phone never stops. Even when I'm at home, the phone calls are coming in starting like 7 a.m.
Mhm.
It's like insurance authorizations that are pending, potential residents that want to come to the facility, families will start calling. I get in around 8:30, look at all the referrals that are in the computer, determine which ones we can clinically accommodate, start making phone calls to case managers, go check on our residents that are new, go interact with the nursing staff, and then just continuously throughout the day, just making phone calls, following up, trying to offer bed availability.
Okay.
And making sure that the residents that are there, their
Are
needs are being
happy.
met.
Yeah,
I know
customer
it's-
satisfaction is the biggest thing. So that's why we check in the morning, just making sure everyone had a good first night, or if there's any concerns on our rehabilitation hall that they're addressed, working with our IDT team.
I know you're always busy. Every time I would pop in to see you, you'd be walking away
Running
from your
around.
office
Yeah.
or not in your office.
Yeah, my office is actually the first office when you walk in, so everybody comes to me. I'm
I
like
know,
the
I'm like-
problem-solving hub. Yeah.
Oh yeah, you're the first door
And she,
home when you
like,
walk in.
she doesn't want to. She's the type of person who just like will continue to come to follow up until the problem has been solved.
Oh
That's
yeah,
good.
I'm like
That's good.
relentless in that way. Like I will not stop until I get. That's why I like doing the insurances too, because I get to like, even though it looks complicated at first, I just keep trying at it until I can get the authorization. I don't think. I know a lot of people say they have problem getting authorization, but I feel like if you're persistent and you don't stop, you can get it. There's always a way you can get it.
And that's a cool side that a lot of families or even like people in industry don't realize a part that you do, that there is some like admissions directors that just stop
Yeah.
after the first decline
Yeah.
or the first no, and you don't. You keep going and going and make sure your residents and your patients have what they need
We have
to build a good
advocate. Yeah.
good care system afterwards.
It's like, what is Heather doing behind that computer? She's not just sitting at a computer. Like she's
I'm
back
trying to
there.
authorize.
Yeah. There's a lot going on back there. If you actually like walk over and look, you'll see like all her little notes everywhere, and they don't make sense to you, but they make sense to her.
Are you a Post-it girly?
Yeah, I am.
I am
do.
too. I have color
problem.
coordinated Post-its.
Or she'll
on my
write on like a piece of paper that looks like it's
I
not an
could see
important
that.
piece of paper. And
Yeah.
And then she'll be like, "Where's my paper?" And everyone's like,
Or I won't write like what it was for, and I'll forget.
"Yeah."
I just write random notes all over the place.
What drives me nuts is bless housekeeping's heart when they
Yeah.
come in my office and try to clean my desk
Mm.
and move my Post-it piles.
Yeah.
I want to cry.
At the end of the day, I kind of just shove it in the drawer.
Come back to it the next day.
Yeah, I'll put like authorization numbers. I'm like, which patient is this for again? But I always figure it out.
So, being at Courtyard for so many years, 10 years, what sets you apart? What sets Courtyard apart and makes them different from other skilled nursings that you've worked at or around the area?
Yeah, so we are the only skilled nursing facility in Davis that accepts Medi-Cal. The only other facility is an RCFE, so it's all levels of care, independent living, assisted living, skilled nursing, and memory care also, but they mostly have availability for their own residents. So we are basically almost the only skilled nursing in Davis. And we have the memory care, which is a locked unit.
Yes.
And we take anyone that needs care. We don't cherry pick. Anyone that needs to come to the facility in the area, whether they have skilled insurance or not, we try to accommodate everyone, especially that way they can be where their family is. So
definitely. I can attest to that.
Mm-hmm.
You've taken some hard folks when I was doing hospice for us, so we thank you.
Yeah, of course. Yeah, it's not all like financial. It has to be a heart behind it too.
I love that.
What are some most rewarding moments working at Courtyard?
Oh, there's been a lot. But I think most recently something stuck out to me. I got a referral for a patient who was at another skilled nursing in the area. And in the referral, he had said that he was having issues at the other facility and he didn't want to return. And I just felt bad, and I thought, you know what, I think we could do better than that. And I called the hospital. I said, I want to take him. I want to bring him in, and I want to show him what skilled nursing can be. And so I don't want to cry, but
I feel that because, you know, even doing admissions myself, sometimes you can look at someone's medical records or, you know, a piece of paper, and you can take them at that, and we shouldn't. Everyone's different. Everyone are human beings. They all have different needs. Sometimes you need a little bit of extra something, and there is places that can do that and meet social and just TLC standards and not just the medical care. So I applaud you for that, because that if everybody did that and took that extra look or took that extra minute or had the heart and the kindness to accept somebody that other folks wouldn't, it would make all the difference in people's lives.
Yeah, it's another human being who needs care.
Especially because
everyone deserves care.
Sometimes the perception is if they weren't happy at that facility, maybe they're demanding, or they're not going to be happy
they're the
here.
problem.
Yeah, and I don't see it that way, because I feel like being in multiple facilities, I know that there is understaffing. I know that you can't always get to the call aid in time. But I feel like with Courtyard, we have a good team, and we always are trying to make sure that the call lights are answered. And if the CNAs are available, the management staff is always walking. Like, I'm always helping answer call lights too. And so I just felt like we could do better. We ended up bringing him in. It ended up being a huge success story, actually. And he got there and he was wheelchair bound, and when he left, he was walking. Aww. And it was and he thanked us so much, and the staff was so happy, and they actually were just like, we can't believe the change that we've seen in him.
That's
and
so awesome.
The progress that he's made. And it's just like restores your hope, and then you remember why you do the work that you do. Yeah. And we discharged him home successfully. And he ended up having an emergency at home, though. His home caught on fire.
Oh my gosh.
Yeah, and we were actually calling. We do follow-ups, and he told us.
Yes, you guys do follow up for a while after.
Yeah, and we ended up bringing him back.
So he's back with you?
Yeah, he's going to stay with
happy,
us.
Huh?
He's a part of your family.
Yeah, actually, the staff all pulled together. They loved him so much, they got him clothes. We ended up using our transportation van to go pick him up.
Oh, that's so
cool. It was like 8 o'clock at night, and everyone on the messages were like, let's go get him, let's go, to bring him in. So it just reminds you, and it just filled my heart, and it was like, this is why we do what we do.
And I mean, the Courtyard team has been together for a while. You got some longevity in your leadership, so
business office has been there forever. Me and Melanie. Yeah
Mel's been there.
She's
for
so
many
smart
years.
though. She knows everything. She should be the AIT.
Yeah, she does.
She's taught me a lot, actually.
Yeah, I learned a lot from her too.
What does she do?
Business office.
But she knows everything. She's like clinical things too, like in the interdisciplinary team meetings in the morning. She knows about services issues, discharge plans.
Oh, that's
You guys were there.
That's good to have someone like that there, huh?
Yeah. You guys were there together through COVID, through the changes and the new ownership, and
I think we've been there the longest.
Yeah,
but we have a really good team right now. I think everyone's been there for like about a year now. And I see the positive changes, so I'm looking forward to the future for Courtyard.
That's good. What advice would you give somebody who would want to do what you're doing?
I would say make sure that you have empathy, and have the heart for it. It's not always just about filling beds and being profitable. I mean, that is a factor, but also just making sure that you listen to the residents, you listen to the families, you make sure that you're able to meet everyone's needs. So that's what I do when I'm evaluating the residents. I'm making sure, like, I don't want to bring a patient in that we can't accommodate just because they have a good insurance or a good payer.
Yeah, that's
like,
important.
I've had to turn patients away just because we wouldn't able to clinically accommodate them, and I knew that, and I would recommend a facility that could do that.
Do you have partners around that you do refer to?
Yeah. Yeah, me and Yachty. She refers to me. I refer to her. When there's people that live in Vacaville or families, we'll call each other.
That's good. What about Sacramento?
Sometimes, but there are a lot of facilities in Sacramento, so it's mostly like the Woodland area. Mostly we do reach out to Solano area.
Solano?
Mm-hmm.
Okay.
She has a memory unit, so I know that.
Yeah.
I didn't even know you had a memory unit.
Yeah, it's a locked unit.
It's in the inside.
There's not a lot of skilled nursing facilities that have memory units.
No, I would have never expected that. So when you were telling us, I was like,
yeah, we mostly have our
cool.
long-term residents back there. We mostly don't put the short-term residents. And it's a unit for residents who are exit seeking, like dental wanderers.
Yeah.
Yeah.
Elopement risk, yeah.
Yeah, me and Yachty actually worked back there during COVID. We took care of the residents.
Yeah.
Oh, that's good.
That's actually, that's...
I mean,
That's for me.
that's the one good thing that COVID did do is I think like everybody in the industry, we wore a lot of hats during COVID.
Yeah,
and
I
we
think it
learned-
brought everybody
hands on
together.
we learned a lot of different aspects of our businesses and other departments, and that was definitely a
The
good
staff, the floor staff were sick, so
You had to
the
jump
managers had to jump in. The administrative staff had no other option.
Yeah, we did overnight. We were there on the knock shift, which
Thanksgiving.
Yeah, on Thanksgiving Day, it was all hands on deck at that time.
Oh, yeah.
Where do you see yourself 5 years from now?
Well, I always told myself when my kids get a little bit older, like my daughter's 14 now and my son is 10, that I wanted to go back to school because I've been working full-time single mom. So, but now that they're older, I think that is the path that I want to do, either doing night school or maybe even doing full-time, just depends.
What do you want to go back to school for?
Oh, LVN.
Oh, okay.
I do want to
So
get my
you still
nursing
have your
license.
nursing dreams. That's
Yeah, I
cool.
still
amazing.
do.
You're going to be an amazing nurse.
You're gonna do
thank
great.
You.
You better go back to school.
Thank you.
You have that empathy. You got
Now
that
Mary
hands-on,
knows.
You see everything.
Yeah, I'm
from
gonna
a
be like,
different
how's that
perspective.
going?
She'll get you. She'll get you.
Well, that's amazing. Do you guys have any other questions?
No.
Well, I want to thank you for joining us.
Thank you.
I loved hearing your story. It was great.
It's an amazing story.
Yeah.
I didn't expect to cry. Oh my God, it's embarrassing.
It's okay. I think I cried my first time.
I think she did. Yeah.
I did.
Yeah.
I mean, we're shaping people's lives and futures, and we're being their family, we're being their caregiver, we're being so many things to so many people. It would be weird if you didn't cry, if you didn't have emotion. Like, you have to have the stomach, the heart, and the empathy to do this job. It's not just, you can't just have one and make it work.
Actually, I do have a question. So, what would you, for the families and the seniors in the community looking for skilled nursing, what information would you like to share with them about Courtyard? Like, what services?
So
we
we
offer?
provide short-term rehab. We have physical therapy, occupational therapy, speech therapy. We are able to accommodate a lot more clinically complex patients now. Like, we can do TPNs. We also have been taking like artificial nutrition, like PEG tubes, NG tubes. We can start taking those now.
Oh, you can do NG tubes. Good.
Yeah, our director of nursing is really training the nurses and getting them ready to take more clinically complex, because it is changing. Our demographics are changing out there, and we are getting a lot younger referrals with people who need a lot more clinically complex issues.
And
so.
the need is definitely there with you, only you and URC being there in Davis. So
The only facility that can take Medi-Cal.
and then the only one that can take Medi-Cal.
Yes,
In Davis, yeah.
that's important. Yeah.
Well, thank you for sharing, and thank you for everything you guys are doing for the
Thank
community.
you.
Dillon
Appreciate
County.
it.
Yeah.
Well,
I feel like
thank you so much.
I've known you a long time, but I haven't known you, and now I like know you.
Now you love her even more.
I know. Now you're just like 10,000 more amazing points. You know?
So sometimes we forget the backstory, you know?
Yeah.
It's amazing how we all touch, like, with the assisted livings and the skilled nursings, how we all integrate and help.
It's all
help our seniors.
yes, and it's all like a big merry-go-round, you know, and you might need this and you might need that, and a lot of folks, just everyday people, don't know that all these little entities exist and
How
what
we're
you can
connected.
do and how we're connected.
Yeah.
That's what we're doing, getting the word out there.
So I do have one more question.
Yeah.
So what would you tell a family member to look for if they were looking for a skilled facility? What do you, where would you, like what questions would you want, should they ask?
So I actually forgot to mention that my grandpa was in a facility, and so
Skilled nursing or
yeah,
assisted living?
that was before I even I was just a caregiver at the time. I didn't get my CNA license yet, but seeing him in the skilled nursing was totally different because I was so used to the assisted living and just how busy it was. I was kind of expecting more like of a home environment, I guess at that time. I was so naive. And I can see that with families too. They're just, you don't know what you're getting into when you go into a skilled nursing facility. And it is the highest level of care. It's more like a hospital environment. So I would just say, do your research, go tour the facilities, go on CMS.com, look at the ratings, because everything is pretty transparent. We all get surveyed once a year. So if there's any deficiencies, they'll document it, and then just go have a conversation with the admissions, meet the team, meet the interdisciplinary team, and then just advocate for your families. Always advocate. Always be
You
there.
never do it enough.
Yes.
So when they come to your skilled facility, is it from the hospital or do families come there and
We
say,
do both.
So both?
Uh-huh.
Okay.
Yeah, we've taken residents from home before.
And then who would they ask for when they are
Like the
looking?
process?
Yeah, like what is the process?
Well, they would come to us first and ask. It's mostly for long-term care because with the way the insurances work, you have to be hospitalized for your commercial insurance to pick up. But for the long-term care, they would call us and then they get a referral from their doctor. We do a bedside or a home. Sorry, cut that out. A home, not a bedside assessment, a home assessment, and we just make sure that they're appropriate for the facility.
So that's for the patients that admit from home. They're more
Yeah.
like custodial. But
Yeah, we've done that for a memory care unit. We've done admits from home.
And then for short term, it would come directly from the hospital.
Directly from the hospital, yeah. Or clinics even
So
sometimes.
then they would ask for admissions directly.
Yes. Yeah.
Heather Calder, admissions director
Yep.
at Courtyard Healthcare Center.
I'm always available 24/7.
She said
Give
24/7.
them your phone number.
We're all
I know.
24/7. You know that.
Yeah.
So how can they contact you?
My phone number is 530-312-4625. That's the admissions cell phone. I always have it on me. Or you can call the facility too to do a tour or anything. I also have an assistant on the weekends who's there, so we always have coverage there 7 days a week. And that facility phone number is 530-756-1800.
Well, that's easy.
Oh, yeah.
1800.
I remember Courtyard's phone number still till this day.
I know our MPI and our tax ID by heart.
Your address.
You know your license number too.
Yeah.
Like it's something that you just learn.
Yep. It helps when you're getting off.
Yes. After 10 years, girl, you better remember them all.
Yeah. I have so many passwords. I think I have like 20 portals. Memory is going though.
Well, I want to say thank you so much. Thank you, Tasha and Yadi, for being
Thank you,
a
ladies,
part
for taking your
of
time
this.
to be here.
Yeah,
Thank you, Mary, for doing this.
You're welcome.
Thank you, ladies, for being the best.
We're the best.
We're
Yes.
the best.
Well, thank you so much.
It's a wrap.
Yep, it's a wrap. We're done.